Hi everybody, I just wanted to create a video so that you can get a better perspective of the Yonkers oral suctioning for your skills validation for next week. And I apologize that we ran out of time, but hopefully this will help. So part of your skills validation is going to be that you will have to suction your patient's mouth orally with what we call a Yonkers suction. So of course I would have the side rail down, I would have the bed up in good working position. This is going to be incorporated into your skills validation. This is what's known as a Gomco suction machine. It's a bedside suction. It can sit on any surface. It's not something that's into the wall. It's something that's electronic and it plugs into electricity. This will already be here for you. The suction tubing will already be here for you. And the Yonkers suction catheter tip will already be on here for you within this package, okay? When you go to use this, let's just say you're doing oral care or your scenario includes the fact that the patient may have some excessive salivation. You don't want them to choke or what we call aspirate on their own saliva, so we can use this tip to suction the patient. To use this, you would just turn on the suction machine. There's an on-off button right here. You hear it running, it means it's on. To test to see if it's on, of course I'm gonna have gloves on, by the way, before I would suction any patient, because again, there's risk of exposure to blood or body fluids. So you're going to make sure that you have gloved hands. Mr. Smith, I'm going to go ahead and suction your mouth, okay? This is a harder tipped catheter. It's not very flexible at all. You can hurt the inside of the oral mucosa within the mouth, and so just be gentle. You can ask the patient to open their mouth. Sometimes if they're resistant, we don't want to shove or force this in the patient's mouth, but let's just hope your patient is cooperative for the day, okay? I've checked it, the suction is working. To really thoroughly check this, a good idea is if you have a little cup of water there, while you're doing oral care, you can use the catheter to suck up that water, and if it does, the suction's working. This suction catheter is working. You would just take this and put this inside the mouth of your patient, and you would suction it. Never go back too far where you're going to gag them. Your goal is to just clean out whatever it is that might be in their mouth that is helping, that is preventing them from being able to, to speak or causing them to be at risk for aspiration. And that will conclude the suction. When you're all done, you will just turn off the machine, and in real life situations, you would then leave the machine on, suction some water just to clean out this catheter, and you always would want to keep it covered. We would just never leave this hanging around. It's not considered sterile, it's clean. However, you want to contain it in packaging, and we would just leave it in here at the patient's bedside and ready for the next time. And this would be good for like a 24-hour period, and we would change it out if we needed to on the next day. Thank you.